Welcome back to Fox 28 Morning Live. This past weekend, people around the globe observed World Diabetes Day. It's a day to bring awareness and response to growing concerns about the escalating health threat that diabetes poses. So today we're with Wendy Sanders, a nurse practitioner at Mercy Care Diabetes Center, talking about especially how with all the holidays coming up, we have family and friends coming in from out of town who we don't normally have to make food for. How can we be sensitive to some of their dietary restrictions and make sure that we don't create things that they can't eat or drink because of their diabetes, and how we can make things that they can enjoy while they're at our homes? And you brought some examples with you.
Yeah. So the first thing I think we need to probably talk about is the difference between type 1 diabetes and type 2 diabetes. So type 1 diabetes is like an autoimmune disease where they don't have any, endogenous insulin. So they are having to give either injections or, use an insulin pump, right, for their carbohydrates that they eat. So in that case, they're just like you or me if we don't have diabetes, right? We can eat pie, we can eat, these things, and they just have to give an injection for that.
Okay.
The second part is like type 2 diabetes, right, where they're, it's type 2 diabetes is fueled by obesity, right? So the more insulin resistance we have from that adiposity, especially in your abdomen, the higher your blood sugar can get with these carbohydrates. So in that case, they really should try and limit the carbohydrates, which is really difficult to do on the holidays. And these foods are some of those that we can consider if you're hosting some of those people with type 2 diabetes. So like more salads, more vegetables, more protein, right? Whether it's chicken, fish, any kind of meat really, cheese, cottage cheese. And then we also have some examples of like no carbohydrate Jell-O.
Oh.
Deviled eggs would be great.
Oh, yeah.
And realistically, this isn't anything here that we wouldn't want to eat normally.
Correct.
When you have a lot of people over, these are just kind of your more healthy options.
Right, right. But when you get, together and it's Thanksgiving, you think about pumpkin pie, and buns, and things like that. So they really want to limit those breads and other carbs.
Very good. Now, so what tips do you have just for practical, how can people who have diabetes still enjoy the holidays but have self-control? That's something that's really hard.
Yeah, so that's a really great question. So it's not that they can't have the carbohydrates, we really just need to limit those. So when you think about like noodles and rice, and this is going to seem very small, but 1/3 of a cup is considered a serving size. Yeah, so it's like 15 grams of carbs is one serving size, and 1/3 of a cup for the rice and the noodles. Potatoes is like 1/2 of a cup, okay? So if you think about that, and you kind of think of your palm of your hand, this is pretty much like 1/2 of a cup. This is 1/3 of a cup, just a couple tablespoons.
Right.
So instead of half of your plate being stuffing, it probably needs to be more salad.
Yeah, good idea.
And maybe on that note, we've seen the rise of diabetes and its prevalence over the past few years. What kind of thing has caused that, and is that a trend that we can reverse?
Yeah, another really good question. So obesity, right, fuels diabetes, okay? And, there is so much information out there, especially on the news and other TV shows showing that, obesity is one of a very big health risk factors for heart disease, diabetes, cancer. So if we can, lower your weight by at least 10%, you can decrease your insulin resistance, decrease the adiposity, especially around your abdomen, which will help with your insulin and help with your insulin work with the foods that you're eating, right? So then that will lower your blood sugar.
Sure.
Very good.
Wendy, thanks so much. Mercy Care Diabetes Center, you can reach them at 319-398-6711. Wendy, thanks for coming in and helping us out this morning.
Thanks very much.